In today's video, we tell you the home exercise routine for people with high blood pressure. So if you want to lower your blood pressure easily, check out these home exercises and how they can help you balance your body's blood pressure and daily lifestyle. Hello and welcome to the channel. If you are new here, hit that subscribe button and turn on the notification to get updates whenever we drop a new video. Don't forget to smash that like button and comment in the section below if you have any contributions. A combined routine of aerobic exercises with some series of muscular work can help us to stabilize the tension. In addition, the subsequent relaxation techniques will help us clear our minds. High blood pressure or hypertension is one of the most common cardiovascular pathologies. It occurs when the pressure in the arteries is excessive, putting a greater load on the heart. According to experts, a cause is often not identified, although it can sometimes appear as a result of an underlying hormonal disorder or kidney disease. For some time now, people have been warned about the risks involved in not taking proper care of oneself, and above all, when a diagnosis of hypertension has been received. At present, many health entities are promoting the adoption of a healthier lifestyle, since it has been proven that it is the best way to prevent this and other diseases. Concerning hypertension, one of the most recommended healthy habits is the regular practice of physical activity daily. Although it was previously thought that physical exertion could have negative repercussions on the heart, since 1989 the World Health Organization, WHO, and the International Society of Arterial Hypertension have promoted exercise as a healthy habit, highly recommended for patients with cardiovascular diseases. Furthermore, they accepted exercise as a non-pharmacological measure to reduce blood pressure values. Experts also allude to the aging process as a drastic reducer of muscle mass, strength, and power, decreasing the ability to carry out activities of daily life. They also recommend the practice of resistance exercises, as these can reverse the damage and help maintain muscle mass by improving strength and endurance. One of the most notorious benefits is the ability it has to help burn calories, especially in aerobic activities. Thanks to this, cholesterol levels are reduced and can guarantee the optimal state of the arteries, the heart, and the rest of the circulatory system. By improving blood flow, there is greater oxygenation of the tissues. In turn, it increases the capacity to eliminate the liquids that are retained there. In general, its regular practice represents a lower incidence of cerebrovascular accidents, myocardial infarctions, and other pathologies that can affect the quality of life or even lead to death. Of course, it is worth mentioning that its constant performance has a positive effect on reducing stress and anxiety. These emotions influence blood pressure readings above what they should. What are the recommended home exercises to lower blood pressure easily? The following exercises have a positive effect on patients with arterial hypertension. They can help control it naturally and easily. However, it is always good to make a prior medical consultation because in special cases a personalized routine is required. In any case, for greater effectiveness, the plan is made up of 3 basic practices, which are aerobic activity, muscle work, and relaxation techniques. Bike exercise. This physical exercise is recommended as resistance training. It strengthens the cardiovascular system, activates the metabolism, and also improves the immune response. In addition, it is a great option to tone and strengthen the muscles of the legs and back without overloading the joints. How do you do the bike exercise? To begin with, it can be done in 20 to 30 minutes. Whether it is an exercise bike or a classic one is the patient's own decision. In general, 3 times a week is recommended, but if more days are possible, much better. Dance. Yes, you heard that right. You might be wondering how dance could help lower blood pressure easily. Dancing is one of the most fun and effective cardiovascular exercises you can do. By involving constant movement of the entire body, it helps improve circulation and increases the rate of metabolism to burn calories. Its regular practice can be very effective since it lowers cholesterol, controls blood pressure, and combats stress. Let all your choreographic creativity come out. You can put on your favorite music or take dance classes. How to do it? An interesting way to make it a routine is by practicing Zumba. This type of therapy usually lasts from 30 minutes to 1 hour. Leg stretch. Constant leg movement helps improve circulation in this area and prevents the heart from becoming overloaded. Due to its ability to relax the muscles, this stretching exercise helps eliminate knots of tension that could be blocking the flow of blood. How to do the leg stretch exercise. The body should be upright, with the legs together and the arms stretched out in front. Now, the trunk is bent forward in an attempt to touch the tips of the feet with the fingers of the hands. Hold this position for a few seconds. Relaxation. Once this simple routine is over, it is good to do some breathing exercises with your eyes closed. Stretch the extremities of the body and focus on relaxation and meditation. Always remember to consult your doctor if you have any particular condition that prevents you from doing physical activities. In conclusion, it is enough that you give yourself a few moments to care for your body. These exercises will take little time and are not too intense. Do not stop trying them. How can exercise lowers blood pressure? The heart becomes stronger with regular exercise. More blood could be pumped more efficiently with a stronger heart. The pressure on the arteries lessens as a result. Blood pressure drops as a result. Millimeters of mercury is used to measure blood pressure. The reading of blood pressure consists of 2 digits. Systolic pressure is indicated by the top number. The diastolic pressure is shown as the bottom number. Normal blood pressure is 120/80 mmHg or below, according to the American College of Cardiology and the American Heart Association. Increasing your activity level can drop both your top and bottom blood pressure readings. It's unclear how much lower it will go. Research indicates reductions of 3 to 6 mmHg systolic and 4 to 12 mmHg diastolic. A healthy weight can be maintained by engaging in regular exercise. Blood pressure can be controlled in large part by controlling weight. Your blood pressure can be lowered if you are overweight by dropping even 5 pounds, approximately 2.3 kilos. Regular exercise lowers blood pressure for 1 to 3 months. The advantages only last as long as you keep up your fitness regimen. Do you need to exercise a lot? At least 150 minutes of moderate aerobic activity, 75 minutes of vigorous aerobic activity, or a combination of the two should be completed each week. On most days of the week, aim for at least 30 minutes of aerobic exercise. Work carefully toward this goal if you aren't used to exercising. Your aerobic exercise can be divided into 3 periods of 10 minutes each. You receive the same advantages from this as from one 30-minute session. Aerobic exercise is anything that makes your heart and respiratory rate increase. Active hobbies include things like playing basketball or tennis, biking, climbing stairs, dancing, gardening, which includes raking leaves and mowing the lawn, jogging, swimming, and walking. The most heart-healthy results appear to come from a weight and aerobics mix. Try to take 5 to 10-minute breaks every hour to stretch and move around if you spend a lot of time sitting. Numerous chronic health issues, such as high blood pressure, are associated with an inactive or sedentary lifestyle. Try going for a quick stroll or just getting a sip of water from the kitchen or break room to add some movement to your day. It could be useful to set a reminder on your phone or computer. Check your heart rate. Start slowly to lower your risk of injury when working out. When exercising, don't forget to warm up and cool down. Increase the difficulty of your workouts gradually. To monitor your heart rate while exercising, take the following actions. First, pause for a moment in what you're doing. Second, check your pulse by placing your index and third fingers on your neck, just below your windpipe. Alternatively, you can use the same fingers to feel your pulse on the wrist's thumb side. Finally, take a 15-second pulse check. To calculate your heartbeats per minute, multiply the result by 4. Here's an illustration. When you stop working out, you take a 15-second pulse check and receive 37 beats. 37 times 4 equals 148 beats per minute. What should your target heart rate be during exercise and at rest? Ask your healthcare provider. Stop if you feel pain. If you experience any warning indications of potential heart problems while exercising, such as chest, neck, jaw, or arm pain or tightness, dizziness or faintness, severe shortness of breath, or an irregular heartbeat, stop exercising and get immediate medical attention. Then monitor your progress. Keeping track of your blood pressure readings is the only approach to identifying and treating high blood pressure. Every time you get a physical, get your blood pressure checked. Utilize a home blood pressure cuff as well. It's ideal to take your blood pressure at the same time every day when doing so at home. Thanks for watching.